Hi, my name is Jennifer Hale, and I'm going to answer a couple of questions. What is a nurse practitioner? The role of a nurse practitioner is working directly with patients. NPs can diagnose and manage most common and many chronic illnesses. They are authorized to perform physical examinations, order and interpret diagnostic tests, provide counseling, education, and write prescriptions. Nurse practitioners are advanced practice registered nurses who are helping to mitigate the effects of the national physician shortage by serving as primary care providers. They hold advanced degrees, either an MSN in nursing or a DNP, national certification in a patient population focus, and a state APRN licensure. The role of the nurse practitioner can differ somewhat depending on the state in which the nurse is practicing. Certain states allow them to work completely independently, whereas others require them to work either with direct supervision or a collaborative agreement with a doctor. I work in the state of Florida, and I have to work directly under the supervision of a doctor. Nurse practitioners follow a patient-centered model, while physician assistants adhere to a disease-centered model. This is a pretty complex and nuanced distinction that starts to make a lot more sense when you start studying nursing or medicine at an advanced level. But in the simplest terms, it can be explained like this. The nursing model looks more holistically at patients and their outcomes, giving attention to a patient's mental and emotional needs as much as their physical problems. The medical model places a greater emphasis on disease pathology, approaching patient care by looking primarily at the anatomy and physiology that comprises the human body. This is an important difference influencing the different specializations available to NPs and PAs. From the time they enter their graduate program, every NP chooses a specific patient population focus as a primary specialty. I myself have chosen psychiatric mental health. This might be pediatric, geriatrics, or women's health, for instance. Physician assistants, on the other hand, more often specialize in an area of medicine like emergency medicine or internal medicine. Another question is, why don't you just become a doctor? I have always been a nurse. I've been a nurse for 27 years. My mother was a nurse for 45 years. Being a doctor had no appeal to me. I knew I always wanted to be an advanced practice nurse. I would be able to work more closely with the patients. Thank you very much.